Welcome to EAC Speaks, the podcast where we dive deep into the movement to end the HIV epidemic right here in the heart of the South, Arkansas. I'm your host, Eddie Wiley, and together we're going to explore the stories, insights, and passion that fuels engaging Arkansas community's mission. Join us on this journey as we unite voices and take meaningful steps toward a world free of HIV stigma. Now, get ready for a conversation that matters. This is EAC Speaks. Hello out there, and welcome listeners to today's special episode where we shine a light on an important topic, National HIV and AIDS and Aging Awareness Day. As we know, living with HIV has dramatically changed over the years thanks to advancements in treatment. However, with an aging population, new challenges have emerged. Today, we're going to explore the unique experiences of older adults living with HIV, discuss the intersection of aging and HIV, and dive into it how we can, as a community, better support those impacted. Now, we're welcoming back Jeff Haskins to EAC Speaks. Hello, Jeff, and welcome back.
Hi, Eddie. How are you? I'm
I'm doing
glad to be
fabulous.
here again.
I'm glad you're here. How are you doing?
Well, I'm hanging in there and making the best of it.
So what's been up since the last time we talked? It's been about 2 years.
Oh, well, I just came back from Arkansas. I was at the HIPC retreat, the first inaugural retreat in
Yes.
Arkansas by the health department. And that was good. And I was the keynote speaker this year.
Yes.
Yeah.
That's amazing. Did they treat you well in Arkansas?
Of course, I've been there 3 years in a row.
That's awesome. Well,
Like,
I'm glad that we have the opportunity to talk about such an important topic because we
yeah.
know this month is going to commemorate the Awareness Day. So, talk
Mhm.
to me about why is National HIV and AIDS and Aging Awareness Day important, and how does it help raise awareness about the challenges that older adults face living with HIV and AIDS?
Okay, well, HIV Aging Awareness Day is important as each other day that we highlight the populations that are infected with HIV, living with HIV. That means we don't do infected no more. That's not a buzzword. It's living and thriving with HIV. And because this population is 53% of the population of people living with HIV, and estimated to be 70% in 2030, we are the largest population living with HIV. So we needed our own day because we have our own issues and our own concerns. And so we wanted to highlight this day, and the government gave us a day to celebrate. And we celebrate that we are still here living and that we're not going nowhere and they can't make no decisions without us.
I love that. We're glad to have this awareness today because, as you mentioned, there are so many particular challenges that the aging population face. And it's not just living with HIV, it's encompassing the whole health of the person.
Yeah.
So that's really important. Now, tell me this: how has aging with HIV affected your perspective on life and health?
Well, my perspective always has been since my diagnosis to live and live well. So I have put the practices and things of things you need to do to live well: exercise, proper diet, um, social connections, friends and family, and advocacy, um, which has always been the thing that we've been fighting for a better way of living. When so many people died, we, I have personally, we buried our dead, but then we had to go on and fight our government to get our medicines and, you know, deal with family members and friends and do a whole education piece around what HIV is and that everybody was acceptable. I mean, could acquire it. that it
Hmm.
wasn't just a certain group of people. So I've always been on the front line advocating to the whole community that we all needed to be aware of this process. And we also all needed to, make sure we were safe, protect ourselves.
Absolutely. Now, you mentioned some of these things, but how has the landscape of HIV and AIDS changed over the years, particularly in terms of its impact on folks living longer with HIV?
Well, it's changed because HIV is no longer a death sentence. I mean, normally, HIV, AIDS, HIV, which progresses to AIDS, and AIDS was a death sentence. What science has been able to do is develop the appropriate medicines that make living with HIV a chronic disease and no longer a killing disease. So we understand that from this epidemic of the 80s, which is similar to our COVID epidemic of 2020, we all have to take our medicine, get our medicine so that we can live well. And that the viruses, two different viruses, but each one attacks our immune system and breaks it down where we get illness and eventually we would die. So I don't have to worry about how I'm going to die, when I'm going to die, where I'm going to die. I just have to live every day until then.
Yes, live and tell the story because
Yeah.
we love to hear the history of how things have come. So if you haven't listened to Jeff's episode on EAC Speaks, definitely go back and listen to it. We talk about some of the history, and we'll dive into some of that today too. Now,
Mhm.
Jeff, tell me, what are some of the common misconceptions about aging with HIV that needs to be addressed?
Well, some of the misconceptions is that people with living with HIV are no longer having sex, and that's a misconception. We are definitely having sex when we want to and with who we want to. Um, and now that we have doxy um, and PrEP to keep it, and we have U equals U,
Yes.
undetectable equals untransmittable. A person that is undetectable with HIV cannot pass it on to anyone else. Um, but we used to say, well, make sure you still use your condoms and stuff because those STIs are out of there. But now with DoxyPep, we have the ammunition to also protect ourselves from STIs. So we've made some progress. And so there's a misconception about, you know, um, we can throw away protection. I still don't think we throw away protection because protection still prevents pregnancies between heterosexual couples, um, or between a man and a woman, because people identify differently. So I just want us to think of safety first. That's where we need to put our efforts about what is going to be best for my welfare, for my health, for my mental state, and also for my spiritual. My spirit
Mhm.
needs to be well. Um, and to your former question, if it wasn't for faith, and it's faith today, that's why I'm still here. I mean, I had my challenges, but I'm still here.
Still here, and we're
Mhm.
grateful for it. Now, you mentioned taking care of your body, your mind, and your spirit. And earlier, you mentioned eating right, exercising. Now, what are some of the challenges, the specific health challenges that older adults living with HIV face?
Well, some of the different challenges are the comorbidities, and you know, it's any normal person. The aging process is a natural process that we all must go through. Now, with an HIV person, scientists tell us that that process is speeded up at least by maybe anywhere as far as 10 years. So, what a person was experiencing in their 60s, the aging population, those 50 plus, will experience in their 50s. And what people experience in their 70s, they'll experience in their 60s. So, because our immune system is been attacked, we sort of get things like hip replacement, knee replacement. Um, our joints are usually the first thing where you feel the pain and aging. We may have cardiovascular disease, we may have diabetes, and we may have other issues. So we definitely um, want to talk about those comorbidities. It's not so that means more pills usually. That we have to take a pill for your blood pressure, a pill for your diabetes, a pill for your high cholesterol, a pill for uh, dementia, a pill for all the other comorbidities that may formulate as we age.
And that's why it's good to do, like you said, take care of yourself spiritually, mentally, physically, because you can alleviate some of those things by having healthier practices. So, and that doesn't just have to wait until your later 50s or
Mm.
60s. I think everybody should, everyone living with HIV should take those practices early on. So I'm an advocate for doing better, even though I'm taking my baby steps, Jeff. I'm just taking baby
Okay,
steps. But there's
okay.
steps.
But that's what, you put one foot in front of the other, and as you keep walking, you get better.
You do
Yeah,
absolutely.
and I know you're an effervescent personality and joyous, and so I know you're doing the right thing.
I appreciate that. I do. Now let's talk about what healthcare providers can do. So, what do you think healthcare providers can do to tailor their care and meet these unique needs of this population?
Okay, so the healthcare providers, um, what we don't have and what we need more of, and this is going to be in the general population of aging, we need more geriatric physicians. Those are the physicians who really study aging and
Mhm,
also have the remedies to relieve some of the stress and tension of aging by prescribing the right medication or by having the patient um, do some other things that will help aid their body as it makes these transitions through life. Um, and if you've got a bad knee, maybe, and you went to a geriatric physician, they might tell you that, okay, you might need to wear a brace on your knee. So when you go up and down steps, you know, it's not throbbing, it's not hurting, it's not you feeling pain because the brace steadies the knee as you go up and down the step.
mhm,
Uh, and some people, because of the way we look, we may not want to use the tools that geriatric doctors give us as walkers and canes.
mhm,
And sometimes people will have to be in wheelchairs to move properly as we're
mhm,
aging. So we want it to be earlier when a person is not at such horrible levels of pain, but in the beginning, and also to help them formulate and get used to using the tools that will make them be more mobile. Uh,
mhm,
and so that's what we need. And sometimes geriatrics have to send us to specialists for
mhm,
whatever our concern is. That most just general practitioners um, are not versed in. I mean, I'm not sure they teach aging in medical school.
Mm,
And how many doctors really have the aging patients or have the knowledge to really, um, assess and prescribe the best method, and whether it's medication or whether it's, as we talked before, exercise, or maybe it's Eastern thought, meditation and mindfulness, and
mhm,
maybe it's soaking in a pool
mhm.
for your aching joints. Swimming is one of the best exercises. And how many seniors go to the pool to relax?
Yeah, it's good that you mentioned that of thinking beyond the medicine, thinking about those things that actually help in a different way. Like you said, helping with the mind as a part of our body. Mindfulness is one of my favorite practices that
Hmm.
they teach us how to eat mindfully, how to drive mindfully, and all of these other practices are really important. And I think that does help with the aging population because there are such unique needs. Now, let's talk about society because, as you mentioned, there is a misconception that old people may not be having sex, or I say old
Hmm.
people, older adults may not be having sex, or that older adults need A, B, and C. So, how do you think society as a whole can better support people who are aging with HIV?
Well, society has to first see us
Mm,
and stop making us invisible. See us
yeah,
as who we are. Yeah, we're gonna move a little slower. Yeah, we're gonna look at you a little longer, but we're gonna keep on moving.
yes.
So recognize us and don't push us to the curb. Make room for us. Go around us. Don't walk over us. Uh, and so society, I think um, we are a larger number as we are living longer. And so we will be around for, a great long time. So get to know us. Spend some
Mhm,
time with someone who is senior.
mhm.
And senior is, or I say seasoned is from 50 to 70, and senior for me is 70, to 90. And then, 70 to 100, and then octarian is 100 plus. So many of us will live in our 70s, 80s, 90s, and some of us into the hundreds
Mhm.
because of the medicine, the advances in medicine, and because people are willing themselves to live. Like, I'm
Mhm.
going to live. They be saying, I'm going to live
Okay, gonna
despite
live.
aches and pains.
Okay. Look, that's some great ways. See the population. You have to see people and know that they are taking space. And by
Mhm.
showcasing awareness days like this particular one, I think it brings a heightened sensitivity, as you mentioned, to those needs because it's really important that we do have this history because without the history, the stories that our seasoned that our elders tell us,
Mhm.
we will continue to repeat some of those lessons, those mistakes, and
Right.
everything else. So I love taking time to speak with my friends who are a little bit older than me and
Mhm.
actually hearing about stories from the 80s and 90s when life was just a little bit more simple than it is now.
Right. Yeah. It's really something to grapple with now. And that's why the positive mind is the most important thing you have
Yeah.
when the noise and the chaos and the divisiveness and the hate is just so prevalent, because that can affect your psyche,
Hmm.
and you can become negative, and it can also affect your outlook on life. So, I mean, aging is really a good thing. The way that it's been taught to us and the way commercials put it is, that it's not such a good thing. But the fact that you've lived this long, um, and some other people have not, is that you have a blessing that the others didn't receive. So you need to honor that, and you know, be blessed in being still here.
I love that you mentioned honoring that piece.
Mhm.
Now, earlier you mentioned having a good support system. Talk to
Mhm.
me of the reasoning behind having a support system, whether it's family, friends, colleagues, healthcare providers, or whatever, and how has your support system changed over the years?
Okay. Well, the support system has been, the people that I've known who first of all, we all got diagnosed. You either was HIV negative or HIV positive. There was no in between. In when this started in 1981 and continued. So, um, the whole support thing was around who was going to take the test and see. And so my support started with my best friend going to the hospital, well, going to the health center with me, I should say, to take my test. Um, and they had already taken the test, so they knew they was next. So for that support, and back then there was no counseling after you took the test. You were just given the results and sent out. Your whole life had changed, and you were sent out and go to an agency, and the next person that will support you is the case manager and the physician, usually at those agencies who were doing the work around HIV and AIDS. So the case manager will give you some counseling, about what your situation is, and then the doctor will tell you how to take care of your situation by prescribing you medicine and say, take your medicine as prescribed. And so if you have any problems with the medication or anything like that, then you just need to, come back and let the doctor know. So that is a form of support to make you able to, get on medications and to fight the virus. Then the next, usually is, I would think, the advocates, who are fighting this dreaded disease. They would be next support. And then you have to decide, with disclosure, who you gonna tell, because like we talked about, there were so many misconceptions around that time, um, 80s and 90s, that people were like making up myths. There's so many myths about HIV and AIDS. You know, like the myth that you can get it from a fork or get it from, off a plate of somebody that have HIV or AIDS. You can get it off the toilet seat. I mean, there were so many ways people came up with, and so those were myths. And then um, family members had to decide, once you told them, whether they were going to be afraid or whether they were going to love you as who you always had been. And so they would be next, and then you tell your friends, and then your friends. Uh, Back in the day, if you were getting sick, you would have to tell your coworker and your boss, because you probably need time off. Uh, and it will affect your livelihood. Then you really need your case manager to come up with some benefits to pay your rent. And um, you know, you needed the state to get your medicine, to pay for your medicine. You needed the government to fund these agencies. So there was relationships developed with so many people. And that's all and then you are your best support. Because once you decide you're not going to die, then you're going to live. You're going to do the best you can with what you know. And so knowledge is a support. And so you read the magazines came out, Pause magazine, the issues on people started talking about it on TV, the news started reporting it. So you learn everything and then you're better able to deal with it.
Hmm. Yeah, and you mentioned some of the things that have happened since back in the 80s that are still happening now. It's a very similar story. I think the innovations have come in. There's more people now to support our advocacy family is so large, and it's
Yeah.
always been big, but I think it's more present now, more open with
Mm-hmm.
having that support because I remember in the late to mid 90s the support system just was not there in Arkansas. It was just so mind blowing to know
Mm-hmm.
how difficult it may have been for folks back then. I couldn't imagine having to disclose my status at the time when one of my cousin's close friends, was diagnosed, and
Mm-hmm.
how much getting emotional. How much bravery it had to take, and how
Yeah.
much fear it also took in order to conquer that. So, yes, absolutely. By having your own support, knowing that you are your biggest advocate is really important.
Yeah, it really is. It's the beginning.
So, let's talk about this. So, what message would you like to share with others aging with HIV?
Well, the message I really want to get out is that you need to be out and about. You need not, you know, uh, isolate socially. You need to have support of others. And there are many now groups that are forming for people aging with HIV. And they're doing great work and great things and lots of trips. And, uh, they got buddy systems and all of that you can take advantage of because it means to keep your mind clear so that you can be as healthy as possible. When you're trying to do this by yourself, it can be overwhelming and it can make you feel like you don't belong in the world, don't want to be out and about. Um, and there is support and help. And I think therapy is one of the best ways to have someone to talk to and also have a supportive friend and family member that you can confide in when
Mm-hmm.
those days when it gets a little rough and tough and hard to handle.
Hmm. Yeah, I definitely value my friends who just even check in on me, even
Mhm.
when I may get quiet.
Right.
They'll just say, "What's going on with you? You ain't been
That's
posting,
right.
or you haven't texted me, or anything like that." So it's really important to have that tribe, as I
Hmm.
like to call them. So let's talk about the future. What are some of your hopes or concerns that you have for the future, even for folks aging with HIV?
Yeah, well, one of my hopes for the future is that the Older Americans Act will put in the special language about LGBTQIA folks who are aged and HIV positive folks who are aging in that one sentence,
Mhm.
so that the states, when they get their money, will be able to support people aging with HIV, setting up their own programs, uh, not it'll be mandated by the federal government that they will, and this will be those departments of aging um, that some states have and some don't. But in order to get that money from that act, you will have to set up something for people aging with HIV and
Mhm.
people and LGBTQIA people age. Two
Mhm.
populations, but
Mhm.
similar, connected, interrelated populations. As I am LGBT, aging, and living with HIV. So those are the three populations that the Older Americans Act wants to take care of in the future. So that's my hope. My fear is basically long-term care. Um, I've seen my parents go through long-term care. Um, and you just got to have stuff in place. Um, and that's not, and a lot of people don't think about it until they need it, and that might be too late. And so mine is make sure I have some long-term care provisions, so when I get to the certain age where it is necessary, that it is available to me, and that the states also help and provide, that the Medicaid and the Medicaid care um, are there for people who worked all their life and need support in their last chapters of their life. So that would be what I concern myself with. That's my concern. It's not really a fear, but it's a concern. I mean, it's something you have to think about and plan for.
Absolutely. And advocating, and that's
Yeah.
exactly what we're advocating for is that inclusion. So you definitely enlightened me on some piece of that. So if there's more inclusion of
Hmm.
older adults that are LGBTQ or people who are living with HIV and may not even be in the community, and the intersections of all
Hmm.
of those things, I think are important, because I read an article recently of, like you said, long term care, and how LGBTQIA folks have a higher likelihood of not having that family support
Hmm.
towards the end of life. And so it's important to have the tribe, to have those government assistance things, so that way people can live with dignity and
Hmm.
get to that place where it's not just isolation.
Right.
So we're coming towards the end of the episode, but I want to first of thank you for engaging me in that conversation. But do you have any final remarks for this particular episode for the listeners?
Oh yeah. Just support people aging with HIV. I mean, any way you can, um, talk to them. When they disclose to you or reach out to you or let you know, be a listening ear and be attentive, because that is a form of support and one of the best forms of support. And just support them in their efforts to make a better life for themselves. And whatever you can do to help them, assist them, just be a good support person.
Love that. Yes, take care of each other. That's a
Yeah.
great message. And thank you again, Jeff, for being
Oh, you
a
welcome.
guest. So tell the people where they can find you. Do you have
Yeah.
website?
Yeah, Jeffrey Haskins on LinkedIn. You can find me there. My email is jeffrey860 @gmail.com. And yeah, so I'm on Facebook, Jeffrey Haskins. So
Yeah.
that's where you can find me.
Awesome. So definitely, if you want some advice, you want somebody to give you some good stories, hit up Jeff, okay?
All right. Hook me up. Let me know. Look me up.
Again, thank you for being on the show. And if
You're
you would
welcome.
like to be a guest on EAC Speaks, Don't forget, you can hit us up online, go to our website, shoot us a DM on socials or any other place. And stay tuned for our next episodes where we do talk about DoxyPep that Jeff mentioned in this episode. And we'll be super excited to bring you that. But until next time, we'll say ciao. Say ciao, Jeff.
Ciao.
The EAC Speaks podcast is partially supported by the Arkansas Department of Health through a grant funded in part by the CDC. All discussion is solely the responsibility of each participant and doesn't necessarily represent the official views of Engaging Arkansas Communities, the Arkansas Department of Health, CDC, or the U.S. government.